Hello everyone, you're all very welcome to the Sensory Differences and Challenges programme for Foreland Syndrome Trust. My name is Kiva and I am a final year occupational therapy student at Ulster University and I'm currently undertaking a role emerging placement at the Trust. I know some of you may be familiar with occupational therapy, but just in case you're not, I thought I'd give a brief description of the profession before we begin. So, occupational therapy is a client centered allied health profession which focuses on the use of therapeutic adaptations, modifications, and equipment to foster independence, enhance development, and enable service users to participate in activities of daily living such as self care, work, and play. OTs are dual trained in both physical and mental health, working through different sectors of healthcare and rural emerging settings similar to the Trust. A big role within occupational therapy is addressing service users' sensory challenges and differences, and in turn, providing them with appropriate strategies and techniques which may relieve their distress. Because of this, I have created this presentation for your viewing, and I hope you find valuable learning within its content. This slide is just to give you a brief outline of what's to come in this workshop. Firstly, we will look at our seven senses, which may sound strange to everyone like me who grew up learning the five senses, but I promise it will make sense as we go along. Next, we will discuss over and under responses to the senses and explore strategies to combat this. And from that, we will look at calming strategies for over responsive children and alerting strategies for under responsive children. Finally, I aim to outline alternative techniques and strategies to enable the completion of your child's activities of daily living. So, as promised, our seven senses are vestibular, hearing, smell, vision, proprioceptive, touch, and taste. So, the two new ones you'll see are vestibular and proprioception. Vestibular is basically our movement and balance, so how we move our muscles and our joints in daily life. And proprioceptive is known as our body awareness. So this is whenever we know where our body is in space. So right now, if I could invite you all to close your eyes, and if I ask you to take your right hand and touch your nose with your index finger and just repeat that 5 times with your eyes closed, you'll find that you may be able to do this and some of you may struggle, and that is your proprioceptive sense. It's the ability to move our body without our visual sense of knowing where we are. So within our senses, we can all experience varying degrees of over and under stimulation. There's a threshold where most of us will feel sensations given from our environment. For example, our sense of touch. We tend to feel the cold or hot or around the same time and will perceive it similarly. However, some of us may fall under or over this threshold, meaning they have different responses to it. They may need less or more of the stimulation to perceive it how we do. For example, you may find that your child could wash their hands with scalding hot water or freezing cold water, and you go over and that temperature will give a shock to your system, but they seem unresponsive to it. That may show that they are either over or under responsive to the stimulation. Over responsiveness is when your child's body struggles to manage the sensory information received and may experience or even perceive the information as negative as a result of this unwanted stimulation. For example, your child may fear loud noises or lose focus when they occur. They may be over responsive to sounds. On the other hand, under responsive is when your child doesn't receive enough stimulation from the senses and as a result seeks more sensory input elsewhere. For example, if your child enjoys crashing to the floor or into the walls for fun, they may be under responsive to touch. It is very important to note that before we go any further that it is very possible and likely that your child is over responsive to some senses while simultaneously under responsive to others. So I'd just like you to keep that in mind throughout. So this now begs the question, what can you do as parents to help? The following slides will outline signs to help you be your own detective and indicate if your child is over or under responsive to their senses, whilst providing you with corresponding management strategies to help. So if your child is over responsive to sounds, so their hearing sense, they may dislike loud noise and become easily startled by loud noises and even respond negatively to them, and may present as anxious toward loud or expected sounds such as a timer for dinner. You may also notice that your child speaks very loudly and experiences magnified sound compared to others. So if the doorbell goes off or if the volume on the TV is too loud, you may see that they may have an overreaction to this as you might not. In order to counteract this, it is suggested that you respect your child's sensitivities by providing a warning before loud noises if possible, enable quieter environments, and possibly allow your child to leave class early for a few minutes to avoid large crowds. So in school, if your child is age if your child is in school already, it may be beneficial for them to leave class a little bit earlier, as those large crowds can stimulate a lot of noise and unwanted sensations for your child. As for under responsivity to noises, you may notice that your child really enjoys loud noises and often makes them themselves. For example, you might find that they sing or hum regularly and talk really loudly. Another sign is if you notice your child doesn't respond to what you say or appear unable to hear you. You may notice that they're not ignoring you, and it might just seem that you are speaking to them, but they don't notice, and it kind of goes over their head in a bit unless you're looking at them directly in the eye or making physical contact for them to understand, oh, mummy or daddy's speaking to me right now. Strategies for under responsiveness include giving your child good eye contact and speaking in a loud, clear voice when speaking directly to them, and allow for sufficient time to process the auditory information offered. Keeping your verbal instructions clear and concise and having your child repeat them back to you to ensure they were heard and received correctly is also beneficial. So you can ask them, can you please go wash your hands after dinner? And then just respond with that with, did you know what mummy just asked you right now? Can you tell me what I just asked you to do? And if they respond back and tell you the same instructions, then you know that it was heard. And if they come back a bit confused, then you know that you may need to repeat the instructions or try a different technique the next time. If your child is over-responsive to visual information, you may notice that they have a dislike for bright lighting and tend to thrive in darker environments or rooms, even loving at bedtime when the lights get switched off, whereas other children may be fearful of the dark. As they get distracted easily by visual information as well, so you may find if you have bright colours or posters or anything in a room that they may be easily distracted and not focus on the task at hand and instead stare at the wall. Strategies for over responsiveness to visual information include limiting visual distractions. For example, in school or even at home, having your child sit away from the windows, doors, or display boards. And possibly consider using neutral colours where possible and use softer, warm lighting and is less harsh on the eyes. So that kind of warm, like you can buy them in the shop, like those kind of warm light bulbs instead of the harsh kind of bright light that some of you may enjoy instead. On the other hand, your child may be under responsive to visual information, presenting with a lack of awareness for the visual information and an obvious preference for brighter, more vibrant environments and rooms. They may show clear enjoyment for reflective lights or moving or spinning toys, and you may also notice that they scrunch their eyes or squint frequently, and even blink excessively and tend to look out of the corner of their eyes and bring items close to their eyes for inspection as they're just so curious as to what this bright, shiny thing is. Suggested strategies for this are having important information displayed clearly and using bright colours where possible. For example, colourful dinners can work well, adding a bit of colour to your plate. I know my granny used to love to do that for me. So even if it's quite a beige dinner, if it's just mash and sausages or something, have peas on the side or sweet corn and make it into a bit of play, like, oh, can you tell me what that color is? And it's really appealing to their eyes, and that may actually entice them to eat it or participate in whatever activity you're doing. You can also provide your child with tasks such as dot to dot or color by numbers, which is very visually stimulating. As for a sense of taste and smell, if your child is over responsive, you may notice that they prefer bland or plain food and dislike strong flavours and tend to overreact or even gag easily to new tastes and smells unfamiliar to them. You may also find that your child likes their food to be at a constant temperature. For example, they may prefer their food extremely hot or extremely cold and not really the happy medium that we may prefer. Suggested strategies for this are providing your child with their favourite scents to block out one they dislike. So even if you walk past, I know myself, the Lush cosmetics shop with the bath bombs can be very overstimulating for myself. And even having a wee smell of just your jumper or whatever you're wearing, and that familiar like detergent smell may bring you down and calm you down from that distress of having overwhelmed your senses. Being mindful and considerate of your child's taste and sensitivity to smells daily is what may be helpful as well. So I would avoid introducing new products without your child's knowledge. For example, changing up the washing up liquid or shower gel without their knowledge can be quite distressing to the child. So I suggest maybe if you're going to buy something new, bring your child shopping with you and have them trial and smell different bottles in the shop and see which one they prefer. And you may even notice an obvious dislike to a certain scent, and then you can kind of eliminate that from daily life altogether, where possible, of course. If your child is under responsive to taste and smell, you may notice that they seek more input, so they often prefer stronger tasting foods and scents such as sour and spicy food, or even enjoy chewy and crunchy food also. You may also see that your child may attempt to eat non food items, so that's like your inanimate objects, like a pen, anything really they bring close to their mouth and taste or lick the inanimate object if they're under responsive. Strategies for this include fostering as many smell and taste experiences as possible and encourage experimentation within their diet. For example, you may think that your child, my child may not like this kind of food, but it's always important to give them those experiences when possible and allow them to try it and see for themselves, if they like it or if they don't. And if they do, there's another thing you can add into their diet, which I know can kind of be a battle for parents at times. Leading on from our senses of taste and smell, it is important to review over and under responsiveness to oral motor activities, which is essentially how our mouth responds to movements. So that's your chewing, your sucking, your blowing, any real movement of your mouth, that's your oral motor sense. Over responsiveness in this area can be identified in your child if they dislike brushing their teeth or tongue and show an obvious pickiness towards food and is shown to often gag easily. The strategies for both over and under responsive are the same. So I'm just going to go on to the under responsive signs and symptoms and then from there lead on to the similar strategies. So under responsivity includes children that enjoy sucking or chewing on non-food items and those who are seen to put food too far back in their mouth or throat and often overfill their mouth when eating. This is because they are seeking that extra input that they may not get from just regular eating. So you may see that even if they are eating something like a banana or a cereal bar, even yogurt on a spoon, they may put it far too back in their mouth or take large bites just so they can have that extra movement, because you know yourself, if you overfill your mouth, it takes extra energy for you to chew and get through it, and that's kind of an activity that they would enjoy. A few strategies suggested for both over and under responsive oral motor senses include practicing facial massages on your child. For example, using your index finger to just dot around the outside of your child's mouth, as it provides in it the sensation that they are craving. Also, that kind of movement of just rubbing their cheeks against their teeth, like that kind of toothache massage that you would get yourself, or if your jaw's giving you a little bit of bother, you would kind of rub there. That can be a really calming sensation for them, because that's the kind of oral motor sensation they are seeking. And if you can provide that without them putting risk for themselves, such as overfilling their mouth or choking on food, then that's a really good beneficial way to do it. Blowing instruments such as a harmonica or recorder and blowing toys such as bubbles and balloons under supervision can be another great tactic for children who are under and over responsive to oral motor. And feeding your child crunchy or chewy foods where possible. So, for example, you can keep it like nice and healthy, like raw carrots or like cereal bars. They're really good, and children may also enjoy thicker drinks, so nice thick smoothies through straws, as it gives that bit of resistance that other food may not. Signs your child may be over responsive to touch include those who avoid physical contact with others, children who only tolerate certain clothing and materials. For example, they may hate labels and seams in certain materials such as velvet or denim, they may absolutely refuse to wear. Children who also dislike messy play and may react aggressively towards touch, and those hypersensitive to temperature may also be over responsive to their touch sense. Strategies tailored to this include allowing your child to stand at the end of the line to avoid touch and enabling them to avoid big crowds where possible. As you know yourself, in big crowds or big lines, maybe not so much in this day and age as COVID has kind of increased our distance from one another. But when someone kind of brushes up against you or walks by you, you may find that uncomfortable within yourself. So, especially children over responsive to touch, they may find that extremely uncomfortable. In messy play, such as a mud kitchen, I would allow tools and avoid directly touching the mess and have wipes on hand to clean their hands when necessary. It is also advised that you give your child a warning before touch, and when initiating physical contact, always use a firm touch and not a light one, as a firm touch shows that you have a reason for doing so, and light touches are kind of unreasonable to the child because they don't know what you're doing. But if you're to take their hand to walk them across the road, they know, oh, mommy or daddy's helping me do this. Whereas if you just put your hand lightly on like the small of their back, they may not know what that is and they may react aggressively towards it. And I would always approach your child from the front so they can prepare for the sensation and kind of use their motor planning to know, okay, what they're doing now, and they can watch you in that progress so they don't get scared. If your child under responds to touch, you may notice that they get too close to others and don't really care about your personal space. So you may find that they kind of lean on others or stand really close to them or really enjoy hugs. They may show little to no response to temperature or pain. And your child may use tight grips on items and require a firm touch to respond to something, showing a lack of awareness to light touches, such as they may not notice someone brushing past them, like I said earlier, or they may not even acknowledge like a messy face after eating or play. So where you and I, if we got food in our face, we may need to wipe it off immediately. Your child, it may go unnoticed or uncared about. Strategies we can deploy for this include encouraging touch activities such as messy play and painting, and resistive activities such as Play-Doh, which provide the child with some resistance, allowing tight grips, but it is still malleable so they are able to shape it and use their creativity. Finally, I suggest sensory boxes as another great resource for your child, as it allows them to identify items and materials with their sense of touch alone. So it is done by using something like an opaque box, like a shoe box, and cutting out a hole that fits their hand and putting in items one by one, such as a teddy bear, toothbrush, hairbrush, even pieces of food that they can go in, and without their sense of sight, they can go in with just their sense of touch and feel and kind of be able to gauge what the item is without the use of their other senses, which may be very stimulating for them and exciting and fun at the same time. So if your child is if your child is over responsive to movement, they may feel dizzy easily and show a dislike for having their feet off the ground. For example, compared to your other children or just even yourself in general, they may dislike things that we find fun, such as going on the swing at the park or jumping up and down, whether that be in the ground or a trampoline. Your child may also appear hesitant for movement. For example, they may absolutely hate getting their head tilted backwards, as it can be very vulnerable for them. Strategies for this response include providing supportive seating that will not tip and also allowing their feet to be firm on the ground to limit distress and keep them grounded. Would also suggest letting your child stand at the front or the back of the line in the stairs and allow handrail use for a sense of control and security. And under close supervision, attempt rolling on the floor or using a peanut ball with their feet on the ground to allow them to explore sensations. So for those that don't know, a peanut ball is essentially two exercise balls that are kind of molded together and kind of look like peanuts that you would get like at a carnival or at Halloween. And it's just really good for that sense, as it has like the little bumps on it, and it just gives them that really nice sense of being grounded while still being free in their movement. If your child is under responsive to movement, you may notice that they move very fast but lack coordination, tend to fidget, move, or tap surfaces constantly, and show an obvious dislike for sitting still and often prefer running over walking. You may also notice that your child rarely or never gets dizzy and instead enjoys spinning themselves or even watching things spin when they can't do it themselves. So management techniques include enabling your child to practice running and skipping, jumping, etc., and introduce animal walking such as bear walking into their kind of daily routine. So bear walking, for those that don't know, is the stage between crawling and walking, which is when you have both your feet and your hands planted on the ground with your bottom in the air, and you can kind of use your bilateral coordination, so your coordination on both sides of your body, and you cross your midline, which is basically if you drew a line down the center of yourself. It's just how they move, and it can help with their coordination and balance, but also give them that extra vestibular movement that they're craving. Pushing and pulling activities such as wall press ups are also suggested for movement breaks in between long periods of sitting. So, if you're sitting doing homework or even a bit of colouring in or something they may find fun, they may get a bit restless. So, having every 10-15 minutes, having a little break to get up and run on the spot, do a few jumping jacks or do a few wall press ups can be very beneficial for children under responsive to movement. Finally, move and sit cushions can be used to help provide and improve balance for your child and allow them to sit up straight in their seats and limit fidgeting. So move and sit cushions are an inflatable rubber cushion that kind of look like a door wedge but a bit more width that they can sit on, that kind of raises their back up and improves their posture by straightening their back and kind of putting their shoulders back, which allows them to sit and use their time at the table to do whatever activity, even eating dinner, a more productive one. So, over responsiveness to your proprioceptive sense is extremely uncommon, but may present as if you know if your child removes themselves from crowds or tight spaces and feels claustrophobic very easily. They may also dislike others being in their personal space. For example, sitting or standing too close to them can make them very uncomfortable. To combat this, it is suggested that you respect your child's sensitivities and avoid high crowded areas. For example, I wouldn't suggest going grocery shopping at peak times and go when it's quieter, and allow your child personal space to ensure they always gain permission before getting too close. As for under responsiveness, you may witness your child to fall frequently or trip easily, often looking down at their feet when descending the stairs to help them avoid falling. They may also stand a bit too close and may lean on other people, either on purpose or unconsciously, as it's a sign of comfort for them. You may notice your child thrives in small spaces, such as squeezing into the corners of rooms, and may seek extra contact, such as crashing into things, and will often have a higher pain threshold and enjoy rougher play as a result of this. Strategies for under-responsive reactions include walking with a full rucksack or school bag on, pushing a shopping trolley, and playing in soft play areas, which provide that kind of sensation for rougher play without the risk of injury. Resistive activities such as Play-Doh or TheraBands can also be helpful. So TheraBands are kind of elasticated bands that you may even notice that you see in the gym for assisted pull-ups. It's kind of those bands that you can place under your feet and pull, or even pull in between your arms, that give that kind of sense of proprioceptive, because you know where your body is when you're doing it, and it kind of gives that resistive activities that they do enjoy. And playground equipment such as monkey bars, ladders, and slides can also be very beneficial. Similarly to vestibular, body breaks from tabletop activities or sitting down can also be used to allow your child to get up, stretch, and move, so that they don't get restless and can focus more on the tasks at hand. So, moving on to the third learning outcome, which is calming and altering strategies for your child. Calming strategies are general changes we can implement daily to increase your child's sensory diet when over responsive. So, sensory diet may be a new term for some of you, and it essentially means that your senses are your nutrients, but your child lacks the desired amounts. So, they're not receiving the same kind of stimulation that you or I would through everyday activities. So, therefore, parents like yourself need to fortify their diet with more sensory experiences, such as these quick fixes I'm about to explain. So some quick fixes include deep pressure massages administered by you or by your child if age appropriate, in which you apply deep pressure to the points of the body they find comfortable, which is often the hands, legs, and arms, as it provides reassurance. Slowly rocking in a rocking chair can also be extremely comforting when distressed, as it mimics the movements within the womb, similar to getting into the fetal position when you're panicked. Giving themselves a hug may sound a bit silly to us, but it improves our self-soothing skills, and it's one of our very important life skills, is to be able to calm ourselves down in distressing situations. And sometimes it may even be applicable for yourself if you are getting a bit too overwhelmed and there's no one else about. Giving yourself a little hug can be very comforting and very calming. Squeezing and relaxing your face and hands, such as scrunching your face and body, can give your child sensations in which they can control and implement when they need. So you may even find yourself, I know whenever I think about this, it comes to me in the form of anger. So when I feel angry about something that I can't necessarily control, I often find if I scrunch and like curl up my fist and release it and curl it up and release it, that I can then at the end of doing that for like a few minutes, I'm not as angry or I'm not as panicked or worried or stressed anymore. So it is a very good technique to be used whenever they are distressed. So more long-term calming strategies which can be implemented into your child's daily routine include going for a walk every day, as it gives them something to look forward to and provides them with the physical exercise and a sense of achievement and joy. Having time allocated to chill out and relax is also very important for your children, which may sound silly as they don't work in 9 to 5 and they're not necessarily doing anything too strenuous. But as you know for yourself, it is very important to have that time to unwind and switch off, as it lets us be put at ease, especially if we are over under responsive to our senses. It's almost as if they're constantly on alert, but if they have a little quiet time to relax, so they're not overly thinking or getting worked up about the senses that they're lacking or getting too much of, it can be extremely beneficial. And helping with manual tasks such as cleaning allows them to gain a sense of achievement through purposeful tasks and may also allow them to experience new sensations such as that kind of heavy work, which is very good for proprioceptive. Moving on to alerting strategies. These are management techniques for your under-responsive child to grow their sensory diet as discussed as well. So quick fixes in this area include fostering fast movement such as running and skipping for short periods of time so that your child may release their energy in short bursts and make them less restless and more focused. Additionally, allowing your child to drink ice cold water from a bottle may sound a bit silly to us all, but can be a really great grounding technique as it is a small, controlled, and safe shock to our system and brings us back to the present and out of our overwhelmed state. More long term daily routine adaptations include frequent movement breaks, such as marching, as it gives us break within given tasks so that they have time spent on the more purposeful tasks can be productive. Incorporating outside play, such as climbing frames and swings, is also suggested under supervision as they require a lot of focus and control, which can allow your child to further their abilities whilst also allowing them sensations that they are craving. Finally, trampolines with a safety net and under supervision, as you all know, can be great activity for your child as it requires a lot of physical exertion and concentration, which allows your child to really hone in on and focus on the sensations provided. For example, their vestibular, proprioceptive, and touch senses are really stimulated within this activity. We're now moving on to our final learning outcome, and this is tips for completing our activities of daily living with sensory difficulties. Our ADLs are functional, purposeful tasks which we carry out each day, and they include anything from getting up to getting dressed to eating, toileting, or even bathing. If I kept listing all of our tasks, we'd be here all day, so I'm just going to stop there for all our sakes. But anything we do, from even sleeping, is an activity of daily living, so anything we do that you can think of is our NADL. So sometimes our sensory challenges can hinder our ability to complete these tasks. So I've compiled the following slides to highlight a few strategies to cope with the challenges faced in order to complete our ADLs so that a better quality of life can be reached for our children. So one ADL which can prove challenging is brushing your child's teeth, or if age appropriate, having them brush their teeth themselves. This task can be distressing to some children, especially those with over-responsive oral, motor, or taste senses, as it can be a lot at once. Some suggested adaptations to improve the occupational performance within this task are trialing different toothbrushes until one is liked or even tolerated, and is found that some suggested toothbrushes include a soft bristle toothbrush, which can be less harsh in the mouth, as we know ourselves that even when we get a new toothbrush, that first couple brushes can be a bit harsh on our teeth and our gums, but a soft bristle toothbrush will still provide the hygienic clean that we need, but will be less harsh in their mouth. A musical toothbrush can provide a distraction from the task, and you can even find ones that last 2 minutes or whatever the appropriate amount of brushing time is. So you can say, we're going to start the song, and then once the song's over, then we can finish and we can go to bed, or we can get ready for school, or get up and get ready for the day. And then that gives them that kind of time, like we're not doing this forever. It will, once the song's finished, we're finished. Electronic toothbrushes can provide a vibrating sensation, which can be very comforting. So, like that kind of index finger dotting around the mouth or the toothache kind of massage I was discussing earlier, it kind of gives that kind of oral motor sensation your child may be craving. A dual bristle brush, for example, a Nook brush, can help quicken up the process by providing an almost two-in-one. As the dual bristle brush, instead of having your tongue scraper on the back, there's another row of bristles, so you can brush the top and bottom rows of teeth at the same time, so you can still get a thorough clean, but there's not as much movement and it won't last as long for them. Finally, a character toothbrush can provide a bit of incentive for the child. So I know Paw Patrol is very popular. I'm sure you've probably heard enough about Paw Patrol. But if you turn around and if there's, say, Marshall on the toothbrush, and you're like, let's go brush our teeth with Marshall, it may become a more fun activity for them and not something to fear or dislike. And finally, in this area, it is suggested that your child finds the taste of if your child finds the taste of toothpaste to be a bit off-putting, I would try using a taste-free toothpaste such as the one on the screen here, OGP 1450 Hygiene Paste / Oral Nurse. It is a taste-free toothpaste, so especially those children that are sensitive to the Their taste senses, that minty flavour that we may find refreshing and calming, can be a bit overwhelming for them. So it is suggested that in order to get this activity done, you may need to just eliminate the flavour of it, which can still be hygienic but not as distressing for the child. Dressing is another ADL which can prove difficult to complete if your child is over or under responsive to touch, movement, or proprioception. Some suggestions include getting your child dressed in the same place every day to establish routine can be very helpful. Also, laying their clothes out prior to dressing in the order in which they would wear them, so have it faced as if they were to put it on directly, that's what it would look like. I would have them dress in front of a mirror also, as they can visualize the task and use motor planning to know what they're doing next. It can also allow them to improve their sequencing and proprioception, so knowing what step comes first, so the vest before the top and the socks before the shoes. If they can watch themselves do it every day, it can get into routine and become more natural for them. I would use comfortable clothes and consider the fabric and length of sleeves for your child's clothing, keeping in mind their likes and dislikes. As you and I both know, that if we don't like a certain material or a certain cut of a top or certain length of a jean, we simply won't buy it. But for children, they don't really have that choice, as they're not out buying the clothes for themselves. But if you can keep in mind that they don't like 3/4 length sleeves, or they really dislike this kind of rough denim, it would be really beneficial for them and less distressing when it comes to getting dressed or even keeping their clothes on. I would also suggest, if these are very simple ones here, if labels aren't tolerated, I would simply cut them off. And the same for seams. If they are not tolerated, I would try and use undergarments such as vest tops, as they may prohibit that dislike sensation, which is often the same rubbing against your child's skin as they use their vestibular movement. That can be the most distressing, as it's just, it may be snagging on the hairs on their arms. The touch sensation may just be slightly too much. So if you can limit that by adding an additional vest underneath, or trying to use like a fabric softener to try and lessen that kind of rough texture, they may find it extremely beneficial. I would also try using unscented products when washing your clothes. A strong scent can be quite overwhelming and off-putting when over-responsive to smells. So something fresh, like I love the smell of clean cotton, that we may find like, oh, this is lovely to wear, a child may find really distracting and overwhelming. So it is important to keep that in mind whenever we're washing our clothes as well. Hair care is another commonly disliked ADL with children, and some general suggestions for completing this include deep pressure scalp massages prior to health care can provide relaxing and calming sensation. So that's kind of like if you think back to getting your hair washed at a hairdresser's, the luxury which it is. Just that kind of movement with the tips of your fingers, that kind of rotated movement can be very, very beneficial for your children, both when washing and pre and post washing as well with their hair dry. It can be very, very relaxing for them. Trialing different hairbrushes similar to your toothbrushes and combs can be very beneficial as well. So try to find one that is tolerated. And I would always use a firm stroke when brushing their hair, just to make sure that they know that there is purpose to the task and you're not doing it just because. But if they know like mummy or daddy's brushing my hair, even if their siblings are doing it, it's just very good that if you use that kind of firm stroke, it can be a bit more calming to them. I would also suggest breaking the task into smaller steps and like kind of use definite time limits. So say we're only going to do this for 5 more minutes, or we'll count to 10 and then we'll stop. It can kind of give them like an end goal so they can see the kind of light at the end of the tunnel. Like, this is not going to go on forever. I just have to count to 10 and it'll be over. And even using things like a visual timer can be very rewarding for children who can tell that, who are of the age that they're telling time and they're enjoying, they're learning about clocks in school. It can kind of reinforce that learning as well. I would also suggest eliminating unnecessary tasks if your child is having a bad day. So if they're extremely distressed this morning or in the evening when you're doing hair care, if they need it out of their face for say PE, or you're doing like an outdoor activity, maybe tie their hair back in a simple ponytail instead of trying to plait it. And with boys, if they're having a really distressing day and don't really want to do much with their hair, maybe avoid putting hair gel in the morning or evening or whenever you're doing their hair. And I would also carry out, similar to getting dressed, carry out the task in front of a mirror so that they can track your movements, so they can have a sense of control and reassurance. And it helps them build up tolerance to the task as well, so they can learn that this isn't going to last forever. I can watch you do this, and I'm more comfortable now that I can see your movements. The activity of nail cutting is another commonly known challenge with children, and thus can be extremely distressing for a child with additional sensory challenges. There's a lot of suggestions within this area, but I'll just break down a few here now. Using moisturizer or lotion to perform a deep pressure massage on your child's hand before cutting their nails may put them into a more relaxed state, as deep pressure, as you've probably heard throughout this, is quite a common technique used for children who are distressed within their senses. It's very common and it's very beneficial to those who enjoy it. By incorporating nail cutting into the bathing routine, it may make the task less strenuous, as the nails will be much more malleable and easier to cut after being in the warm water. And by making it a routine, it will be less shocking to the child, as they will know when it will happen and what will happen when it does. Additionally, I suggest using cuticle scissors or emery boards opposed to traditional nail cutters, as they may be more tolerable to your children and may come off as less frightening or scary. Role modeling, as you know, as a parent, is one of the best behaviours and a core skill of parenting, and thus can be used within this task. So, if your child sees how you can do your own nails and cut your nails or cut their siblings' nails free from fear or pain, they may be more likely to give it a go or wish to mimic you, as all children learn from mimicking. Monkey see, monkey do. If mummy or daddy or their siblings or friends or aunts and uncles, they can see they're doing a task, they may be more likely to be like, oh, I want to be like them, I'm going to do it as well. And then it will be less scary and more adventurous for them. Breaking the task up into smaller sections, such as cutting two nails at a time over a period of time, can also be less invasive to the child. And finally, having your child place their finger on the tip of their finger on the edge of the table so that only their nails are exposed may also help the task, as it puts the child in charge as such, for they control what you touch, cut, etc. Because often when you're nail cutting, the most distressing thing for the child is giving over the control of their hand. So when when you grab their hand or to like to cut their nails, you're holding it in kind of a firm grip, just so that they don't wriggle, so then no like injury is met. But that kind of giving you over that sense of you have my hand right now and I can't move it is often the most distressing. So if they're the one in control of showing you you can cut this nail here and they press it up against the table for you to access, it is less distressing for them and they feel more in control, which can also reap better outcomes for the situation. Personal hygiene's ADLs cover a lot of our senses and thus possess a lot of potential challenges. So, some tips include ensuring your bathroom lighting isn't too harsh and try and reduce noise to a minimum. For example, I would run the bath if they're having one beforehand so it is ready for your child, and it also allows the scent to fill the room, which can be very soothing. As you or I know, if I know that there's a bath around for me, that it almost forms a sense of excitement that you can then go and relax, and the smell is very comforting, especially if you use like essential oils such as lavender. It can be very relaxing, especially before bedtime. I would also ensure that you use firm pressure while washing or drying with a towel, and keeping in the direction of your hair growth for comfort, as the way your hair grows is also the way your blood flows within your body. So it's also great for deep pressure as well. I would very much encourage your child to wash themselves whilst bathing as well, as they may dislike getting their face or body washed by you, but self initiated touch can cause a lot less distress. If using the shower, I would allow the young person to use the handheld nozzle if available and allow them to control the force and direction of water, as it increases their independence and sequencing skills. Finally, similar to the washing detergent, if your child is sensitive to smell, I would try a scentless body wash, as it can still be hygienic but less distressing for your child. Toileting is one of our more personal care ADLs and can be a very sensitive task to complete. Some strategies and techniques used to aid within these tasks include using a small padded seat and stepping stool in order to keep your child grounded and secure may prove beneficial, as the young person may feel vulnerable with their feet off the ground, especially if overstimulated by vestibular movement. Providing positive verbal encouragement and providing your child with possibly a favorable activity whilst toileting, such as I spy or knock knock joke, can also be beneficial. We all know that verbal encouragement. I know myself that if I get encouragement to do something, that it's more likely for me to fulfill it and do about my role. And you've probably seen a lot with your children as well, like providing verbal encouragement. It can be really beneficial in all aspects of life. So why not use it in toileting as well? If your child is not yet toilet trained, I would suggest beginning a routine and getting it in place. For example, place your child in the toilet or the potty after meal times or before bed, etc., as this will make toileting less alienating and more familiar when the time comes. If your child is distressed whilst using the toilet, the goal is to build up more time on the toilet and doing the task. So you can do this by singing your favourite song or having a clear count to 10 or even a visual timer to show them that it won't last forever and it helps them build up tolerance within the task. Finally, smearing may be a new term for some people, and some may have experience with it previously. But it is defined as when your child smears their faces, usually with the use of their hands, and it commonly occurs at night. If your child is smearing faces at night, try using strong scents in their room, such as essential oils, and maybe possibly use tactile activities before bed, such as water beads or shaving foam, and if safe, allow your child to bring a fidget toy to bed. This kind of gives them the sensation they're craving, as smearing is often done when children are under responsive to smell, touch, um, senses, as it's often quite an odorous activity and it does give them that kind of soft, warm feel. But if you can provide this either at bedtime with the essential oils or before with the tactile activities, it may prevent this. But I would suggest that if smearing continues, to seek behavioural support. Feeding can be a very uncomfortable task to some individuals with sensory issues, especially those with taste, smell, and oral motor sensitivities. Tips for making feeding more enjoyable and less distressing include setting a meal time and maintaining a calm environment when eating. I acknowledge that it can be very distressing when your child isn't eating, but they may pick up on your stress, so it is really important to try and remain calm and use some of the following techniques. Try and have a wipe or wet cloth at the ready if your child becomes distressed. For example, if they have food in their hands, face, or clothes, especially you may notice this if they are over responsive to touch. I would also consider segmented plates for those who don't like their foods touching so that they can eat on their own terms independently without panic. I would never try and sneak food into your child's meals or change their main food, as they may see this as a form of deception and trust may be lost. If they find out that you have added in a new vegetable or something that you've tried to sneak into their food, that may limit that food from their diet and they may not eat it again. If your child has poor body awareness or proprioceptive senses, I would possibly trial a footboard underneath the table for stability and grounding, or even a smaller chair and table so that their feet may remain grounded and limit fidgeting to a minimum. Finally, to avoid visual association, which is when your child will only eat a certain type or brand of food and nothing else, I would suggest taking the foods out of their outer packaging before serving it to the child so that later down the line, if you change the brand of bread or chocolate bar or whatever, that they may not avoid eating it and may refuse to if they don't know what the brand is in the first place. They may be more likely to, oh, this is the same, or this is what mommy uses anyway. Finally, if you find it difficult to introduce new foods into your child's diet due to their sensory challenges, I would suggest please trying to provide experiences to learn about and try new foods through the different senses without taste. So, using your sense of sight, smell, and texture can even allow them to build up tolerance and acceptance of new food without forcing them to try it. You can also try and encourage oral motor activities for children, such as blowing through a straw or using a vibrating toothbrush, as it offers new sensations and sensory input they mightn't have had previously. If it is the task of introducing the food itself which is challenging, I would try and use play to introduce new foods or stories and encourage children to touch and smell without pressuring them to eat it, as it can encourage their curiosity and foster it to grow without being forced. However, it is very important to note that often a limited picky diet can often be a control issue of and your own child's tastes and preferences rather than a sensory challenge, as we can all have our sets of likes and dislikes, because I know definitely do. I'd like to thank you all for watching this online recording of my Sensory Differences and Challenges programme. I really hope you found the contents of my workshop helpful. Thank you so much.